Thank you very much. I am looking at spiritual or pastoral care during pandemics, and I'm looking specifically at how the response during HIV and AIDS has been replicated again during COVID-19. My presentation will draw from my PhD work, which is the impact of stigma on grandmothers parenting grandchildren orphaned by AIDS. And based on the experiences of the grandmothers against poverty and AIDS. These are grandmothers who are parenting grandchildren orphaned by AIDS, and their HIV and AIDS related reality, the fact that they had their own children acquire HIV, and in a time when antiretroviral drugs were not very readily available, and most of these children then died, leaving behind a trail of grandchildren in the care of the grandmothers. This reality was so devastating, such that these grandmothers felt overwhelmed and went looking for their pastors for the much needed spiritual and pastoral care. Now, what happened when they looked for the pastors? We see that the research reveals that the pastors were not available. In other words, they were not ready to give the much needed pastoral and spiritual care. So the pastors responded negatively to the grandmother's cry. They labeled them, the homes, they labeled their homes, the homes of AIDS. They stigmatized them alongside the community. They also joined the community in isolating them, discriminating, abandoning, and shaming them. So we look at why this much needed spiritual care was not available, or why is it that the pastors did not, why is it that the pastors did not offer the spiritual and pastoral care needed? We realize that the early responses to the HIV pandemic propagated and sustained fear and other factors that hindered pastoral accompaniment. Some of these being associating HIV and AIDS infection to sexual promiscuity. You'll know that in Africa, sex is a taboo. So if the disease is associated to sex, then it hinders any positive interventions. Then there was also the lack of accurate knowledge and information relating to HIV. There was a lot of misconceptions and myths. There was lack of adequate theological training on the part of the pastors, and there was also confusion between faith and public messages, such that the pastors confused the messages of health and the messages of faith, offering both or interacting both and causing confusion in the responses that were given. So just a minute. The observations that we have made in COVID-19 is that similar approaches have been applied and the same factors are in play. For example, early responses of COVID-19 propagated and sustained fear and other factors that have continued to hinder spiritual and pastoral accompaniment. One of them is associating COVID-19 infection to sin and branding it a punishment for sexual immorality. We saw in the very early times in our context, vocal pastors saying that God was punishing the West for practicing gay marriage, and they even prophesied that Africa will be spared. And this therefore was influenced by similar determinants that influence the responses of HIV. Again, inadequate knowledge and information, misconceptions and myths, lack or inadequate theological training. For example, you find a pastor saying, a pastor offering communion to the congregation members using one spoon, and when challenged, he says, I have been distributing communion since the time HIV was bad. Up until now, I've never contacted HIV and AIDS, somehow implying that using the same spoon will not be a risk in the age of COVID-19, which shows that the person already has inadequate information, and also their theological understanding is mad. For example, also arguing that COVID-19 cannot be transmitted through the elements because the elements become the actual body and blood of Christ. And the question then becomes, what about the vehicle or the vessels that hold the bodies of Christ? Are they also transformed? Are they capable of passing the virus? So there is this also the confusion between faith and public health messages and interventions. We see that some pastors will say that if we are in the church praying and praising God, COVID-19 cannot find us there. If you are singing or praying together, COVID-19 cannot find you there. And it shows that there is confusion between faith and public health. The feeling that faith can prevent you from contracting a disease which is contagious. And therefore, there was also the risk factor which influenced the responses. For example, the fear of contagion. One of the observations that we have made during this time is to see that during when COVID-19 came and the government started shutting down activities, the churches were shut down. And the churches were shut down, and when the churches were shut down, the pastors began to say that they have not been considered as essential workers. So when the pastors were called upon in the era of HIV and AIDS, especially by the grandmothers, to offer the much needed spiritual and pastoral care, they ran away. They also sent away those who called them. We had instances of grandmothers saying, my daughter is dying, can you please come and pray with her? And the pastor would not go anywhere near. Or even saying, my son has died, can you please come and say prayers at the grave? And the pastors would not go. But during this time of COVID-19, the pastors came out to complain that spiritual and pastoral care was not being considered as an essential service. And therefore, you see, there's the need, therefore, to investigate why during this COVID-19, pastors complained, yet during HIV and other pandemic, they did not respond when called upon to offer the spiritual care. Before even we respond to that, we need to interrogate also this failure and denial of pastoral care. What does it do to the congregation who very much need it, or to the people who very much need it? In my research, the grandmothers refused to take this lying down. They realized that there was a gap in the pastoral ministry. They realized that the pastors had missed it. They realized that the pastors had missed the mark. They had failed to understand about the pandemic HIV. And therefore, they stood up and challenged the pastors to come forward and understand the pandemic so as to respond positively or appropriately. During the COVID-19, we see that we need to interrogate what is driving the pastoral care or the urge of pastoral care from the pastors. Are the pastors being denied to care for the people living with the pandemic or affected by the pandemic? Or what do they interpret being asked to close churches and being able to offer pastoral care? And we saw that during this time, there was so much innovation, social media, internet, live streaming of worship, but still the pastors kept complaining, we are not being considered as essential service. So there is need to unpack that pastoral care, pastoral spiritual care, accompaniment. What is it? How does it need to be packaged? Who needs to offer it? Who needs to receive it? Who prepares the person who offers it in terms of training and other accompaniments? So there's need to really investigate why the church finds itself inadequate to respond to these pandemics. There is need, therefore, to see where the interlinkage between public health and pastoral and spiritual care need to happen, especially in theological training. So we see that the implications for theological institutions, therefore, is the need to interrogate their curricula. Before, during, and after pandemics, theological institutions should prepare the pastors to be in a position to offer pastoral care. And therefore, public health should also be incorporated into the theological curricula, because we see the misconceptions that were there during HIV are still being experienced during COVID-19. The mix-up during HIV, pastors preach that if you are born again, you cannot contract the virus. In COVID-19, we have heard that if you are in the church praising God, you cannot contract COVID-19, which shows that there is a disconnect. There is a disconnect that the pastors may not quite be understanding the issues of public health and how that relates to faith and to spirituality. And therefore, there is need also for the established theological institutions to find ways of reaching majority pastors who are not theologically trained, who are out there and they have the call to serve and to accompany people spiritually and pastorally, but they do not have the tools or the skills. Yes, thank you very much.